Hello everyone, welcome back to my YouTube video channel. I would like to show you a continuous case where I started last time. Let me share the screen so you have an idea what I'm talking about. We have mentioned to you about a case of the bridge that we left behind, and we want to see how this case look like. So let's just jump right in and share your screen here. So remember the case last time I mentioned to you guys about we were trying to improve this look of the patient. On this case, you can see that tooth number A is shorter than number 9. Number 9 have gum recession, and number 11 have gum recession. And if you pull up her lip, and you can see that there is an uneven gum gingival recession on number 9 and 11. So before I started, I already know that when I take this replacing the bridge here, I would have to minimally at least give a patient another veneer right here or a crown right here. And then that will give the patient a little bit more symmetry smile. We could have done more with a bunch of crown here, but you know, I discussed with the patient the option of doing conservative approach, minimally replacement. Patient agrees, so I just only replaced number 8, 9, 10, 11. And I also had to do a little gum gingivectomy right here in order to align the smile. So follow me and see how it turned out. Okay, last time we showed you, we present to you again, this is intraoral photo before we started. Recession here. I did numb the patient already, so ready to start. Just show you the metal bridge here, and over long-term metal cause recession compared to porcelain crown. Okay, so these are before we started. Okay, before we start, this is how it looked like. I want to make sure you guys see everything like that. And and I also show you a video that we did prep the tooth. So I want you to see it, how we started. And I will summarize. I just want to show you the bridge. We put up the bridge. It took a little while, not fun to do, removing the bridge. And I mentioned to you also on the previous video that we did laser. So we have to do some laser gingivectomy to balance out the gum high between number 7 and 8. That's what we did right there. I want you to see it so you remember what happened. And after we did gingivectomy, we should be able to take the impression on the same day. And so that's, I want to finish that. And now to re-prep the tooth. The gum high is the same level, and I just want to move forward. So just to recap the picture of what you've seen last time, and I want to show you real quick the end. So I'm going to stop right there, and I'm just going to jump to the next slide. So this is before, and if we gave a patient a temporary bridge, really temporary. It could have been the better, but this is like, you know, one visit deal. We didn't repair the biotem. So temporary bridge, and give a patient a completely different look. And you can see the balance between number 7 and 8, 9, 10, with a new balance bite and smile, a temporary one. And so this is before, and this is after. These are the, you know, the 4 units that we digitally scan and receive it on the same week, and then so we deliver. Right after that, we took out a temporary, we deliver a bridge, new one that you can see, a nice balanced one. So this is before and this is after, and you can see that tremendously improvement in terms of the gingival height. Everything is equal now, and number 6 could have been a little gingivectomy if we like to give it the best. However, the patient doesn't smile so much until she gets used to it with the smile line. And of course, we're going to redo the contour of number 6 if we want to give the best shot You can see the nice balance of the incisor translucent color. And you see right after we deliver, she barely able to smile. Give her, sometimes you're going to be able to show more the pilgrim later on. But anyhow, the case is done, and we'll follow up to see her take a final photo in a few months and see what she look like. This before, this is after, this is before, and this is after, guys. Again, as you can see that it is, to summarize this case, the reason I want to show you young dentists is that when you look at the case like this, you have to determine the gingival contours, gingival height of all the incisor teeth, and if especially the patient that has high smile eye, you need to be able to give the patient the best outlook later after the result. So you have to do laser gingivectomy. So that's where you can take the impression on the same day. And it's important to have that kind of tool in your office. And also digital impression nowadays is so amazing. I want to go back so you can see that digital impression here. Let's see. I want to go back here. This is digital, you see, all digital. Scan it, print it out, and deliver from the patient mouth. So I love it. I love digital dentistry. I love laser. I love combination of technology that help me go through things quickly in my day. And I love dentistry. I just want to share everyone. Hope you like it. If you like what you see, don't follow me, subscribe to my channel, and I will see you next video. Have a great one. Thank you.